us Dr. Lalit Kishore, and he will talk to us about the medical model of cognitive learning. So, sir, my first question to you is, what is cognitive learning?
Yeah, cognitive learning is the learning which involves your mind and its thinking. Thinking is a cognitive function, and it starts with recognizing things, knowing their attributes, labeling them, or naming them, comparing, classification, analysis, going to paths, finding out relationships. All these are the cognitive functions, and they are related to thinking. If we make use of all these functions, then only cognitive learning happens.
Okay. So, sir, how is medical science related to cognitive learning?
In fact, all the subject areas, they are related to one another, and we have got to work towards unity of knowledge. And boundary breaking between various knowledge areas is also a cognitive aspect. You have got to think how they are related. And secondly, learning is also being treated as a process-based way of doing things, making sense. And same is the medical science. So everything is trying to become a science these days by making it process-based. So both areas, cognitive learning and medicine, they are process-based these days, hence they are related.
Okay, so then what is the medical model of cognitive learning?
This model of learning, medical model of learning, treats that everything has got some kind of present status, which is not optimal. And there are certain symptoms which tell you what is the actual situation, maybe that of even your mind and your cognition. And then it gets to the next level of finding out some kind of diagnosis to find out to what level the difficulties or symptoms they are telling the degree of situation. Then comes treatment, and after treatment there is a follow-up, and with follow-up there is a situation when again a diagnosis is done to find out whether one has reached the functional level again. So this is the way. And learning can also be treated like this. In the present situation, a child may be having learning difficulties. And these learning difficulties must be intervened into, which we call treatment, teaching as treatment. And then it has to be some kind of diagnostic testing has to be done, and remediation has to be done, or corrective feedback is to be given. And till that level at which you are aiming at is achieved through the treatment. And this is the way it happens. And if we apply it to the classroom, then we are making use of medical science model of classroom instruction or cognitive development.
Okay, so then how exactly can we implement it in the classroom situation?
You know, you are going to train teachers to apply this model. And then you have got to have certain learning material according to that. And first thing is, you have never to hurt the self-esteem of the child, as you don't hurt the self-esteem of a patient. Rather, you provide service to the patient. Similarly, children are needed service. So give treatment, diagnose, do remedial teaching where they are still having difficulty, give more teaching or give individualized instruction, give more guidance. And when you do all this, then you are applying the quality. So teachers are to be trained into it. Their lesson plans are got to be accordingly. Then they will
much for answering these questions.